matter, we're skipping around a little bit and trying to put it together for you. But to get to the heart of the matter, you have to make money at this. And we're going to spend a little bit of time up front, doctor time, establishing a very firm family-like relationship with our patient who has gotten a positive referral of mouth and has looked at our website and looked at into the other possibilities and found this to be very appealing and non-invasive. It doesn't involve drugs or surgery. So you're going to want to broach this subject in your mind as well as to the patient, and I call it the heart of the matter, is how are you going to get paid for this upfront time? And that's because I don't deal with insurance. So it's allowed me to see patients that have the wanna and have enough discretionary income or ability to get the financing or help from family or church or friends to get this done. I've had patients that have been successfully treated, paid for another patient to come in because they knew they couldn't afford those services, but they pay up front. So after the consult and after they've, so to speak, pulled the fishing bobber down a little bit, you set that hook and say, if you want the service, we can take care of it right away. You come in, and when you bring us the check, we have started everything that you need, and it's all taken care of in this one lump sum. And that sum for us right now is $5,300 for 2 appliances and 2 spare appliances. Basically, the reason I'm sharing this with you is these fees may vary in the beginning for you until you build up your confidence in them, but I figure in what I need for that upfront time and the number of adjustments I'm going to do or need to do. And some patients it varies, but if you quote one fee and you do a couple cases, you'll realize trying to charge a person every time they come in is shooting yourself in the foot and them, because it's like an ortho case. You're done when you're done. And so after a while you learn what it takes, and you've already prepared a lot of these patients for you don't know what they need, but the first stage is $5,300. It can get more involved, but if they like the results that they've been getting, just want more, by having this income up front, then you take away the question of a third party being involved telling you what you can't do and can do. The timing is a lot faster, and the patient isn't worried about coming in because it's all covered for, we give them 2 months and 8 visits. And we get that done by a lot of times having the assistant come in with the patient's appliance pipped, and I can see where that is touching and needs to be relieved, but I don't have to be there to do it. They do it, they put it back in, check the work, come back in and show it to me. Too heavy up there.
Yeah, the leg jerks have kind of come back last couple of weeks.
And show him why. He's blocking both sides. Yeah. So take that out. And he's doing pretty good here. Might have a little trouble getting over that.
Okay.
Blocking there, but this is big. All that is where his leg jerks are coming.
Gotcha.
Should be able to get those out too.
Hell yeah.
All right. I monitor everything that patient does, and you'll have paperwork that you can also monitor, change it, whatever you want to do, but I make sure that they have an incoming diagnosis, which is impaired oral function, and leaving, we balanced oral function. That's what we did that day. The incoming vitals, outgoing vitals, a treatment plan for next visit, which would be to balance oral function, and a near-term visit, which we have a date for, and so that we can actually let the assistant do a large part of the visit at a much lower cost than me sitting there doing each one of the cases. Now, you may have to do a few cases on your own to get the feel of this, but after a while you realize that you can manage a case and be doing a case at the same time, another case, starting it out. And Jesse may come in the door here while we're working. He just was in here, and he showed me a case of a man that had come to us and is completed. He was very happy. One of the things he had was restless legs. He's come in for his recall visit, and one of his complaints was his restless legs. The PIP is not moving out like the wake of a boat when the tongue comes in, and so we know that it's not coming over the teeth. And you can see on the teeth, the PIP is wiped completely off. It's stuck there. So we're going to reduce that, get the teeth over, get the tongue back up on there, and his restless legs will go away.
Talk about how to train an assistant. Or how
Yeah, so you have on your staff, some will be more likely to want to do this than others. It's imperative that they be people, people, that they love working with the patient, and it's a different, a lot of times, than just sitting in a stool passing instruments over and cleaning up or setting up. This is really setting the room up, seeing the patient, do the vitals, bring the vitals and the complaints and the PIP compliance. I give them a treatment plan, tell them what to do. They go back in, do it, come back and show me. It's back and forth. They get a lot of exercise, and they get a lot of time with the patient, and they feel like they're doing something. They've never working inside the mouth, and they're everything they've done on the appliances is being overseen by me. That takes a person that's a people person, but you have 2 or 3 doing that while you're doing work with the patient or treatment planning on a case. The numbers start working out that you can spend a lot of quality time in the front, and so that while Jesse's forming a relationship, I can go in and kind of banter back and forth, talk about the family, discuss what Jesse's doing with Jesse and the patient, and then leave. I don't have to stay there for more than 5 or 10 minutes. I definitely think this work should be done outside of a busy restorative hygiene type practice where you've got all of those distractions, or you're working worse on surgery or some kind of restorative procedure that needs your constant attention. And it's basically why I eventually should have gotten either an associate, or what I did was sold the practice. But I don't recommend selling the practice. That was just the right thing for me to do, but for somebody that wants to do this, you keep your patient load, they're your referral source by your hygienist and other assistants. A lot of times the assistant chairside will say, I'm looking at your health history here, and you're now taking Ambien, and you've got something for headaches, amitriptyline, and you've got all these other things you're taking. Has Dr. Whitley said anything to you about? Look at this information, or here's a book. All of this is seed planting, so that basically in the end, the way you get paid for your work isn't all your work; it's the staff's work too. They're much more participative in the actual production. And believe me, they're more motivated and feel a part of what the practice is doing, and really a lot more medical and dental interrelationships are starting to form because the patients, the assistants, realize we need to work with the medical profession and reach out to them and help get this person off the meds. It's not always on more meds. Most of our patients are getting off their meds. Jim, who you've met, is off his blood pressure medication, and he's on, so far he hasn't had another AFib occurrence. He's still taking, or has the CPAP, and probably will for some time. We're not looking to do too much too soon. He's already had an extraction, and things are healed well, and you never know he even had an extraction, and his blood pressure stayed down. Had that appliance not been in there, the blood pressure would have probably been going up to the stratosphere, because the tongue now would be going over to the extraction site. His autonomic nervous system would try to compensate, and we have more cardiovascular stuff than we ever dreamed of. So when the tooth is lost, everything changes, not just the bite. So the whole purpose of the why we do this is to save a person's health, to save their lives, to give them hope when they feel so hopeless, and to bring many times order out of chaos, and to get this out to other dentists and other patients so that this is common knowledge. You're a pioneer and causing a paradigm shift by just looking at vital functions while we're doing dentistry and saying, hey, we can actually optimize these things. Good.
Okay.